and the external auditory meatus, or ear canal, which passes inwards to the tympanic membrane. We'll look at the auricle first. The folded outer rim of the auricle is the helix. The helix spirals down into the floor of the central concavity, the concha. The rim of the concha is defined by this curved ridge, the antihelix. Two projections, the tragus and the antitragus, partly hide the entrance to the external auditory meatus. The shape of the upper three quarters of the auricle is determined by the cartilage that forms its framework. We'll divide the auricle along this line to see the cartilage. Here's the cut edge of the auricular cartilage. It's highly elastic. The skin of the auricle is attached to the cartilage closely on the front, less closely on the back. The lowest part of the auricle, the lobule, contains no cartilage. To look at the external auditory meatus, we'll remove the auricle and the surrounding skin. The external auditory meatus is lined with skin. It isn't straight. It curves slightly upwards, then slightly backwards. The external meatus ends medially at the eardrum or tympanic membrane. This is part of the tympanic membrane. We'll see all of it in a minute. The outer part of the external meatus is supported by a partial tube of cartilage. Here's the cut edge of the cartilage. It's continuous with the cartilage of the auricle. To see it better, we'll remove the surrounding soft tissue. Here's the cartilage of the external auditory meatus. It extends much further below than it does above. To see where we are, we'll take a look at the same area in a dry skull. Here's the bony opening of the external auditory meatus. The cartilage of the external meatus is attached to bone here. Here's the beginning of the zygomatic arch. Here, just below it, is the temporomandibular joint. The condyle and neck of the mandible lie just in front of the external auditory meatus. Going back to the dissection, here's the capsule of the temporomandibular joint. With a finger in the external meatus, it's easy to feel the condyle moving. Now we'll remove the mandible so that we can look at the external meatus from in front. Here's where the cartilage of the external meatus attaches to bone. We'll remove the cartilage to see the bony part of the external auditory meatus. This brings us closer to the tympanic membrane. Here it is. To get a complete view of it, we'll remove this part of the bone. This is the tympanic membrane. It separates the external meatus from the middle ear or tympanic cavity. The tympanic membrane is so thin that it's partly transparent. This small upper part of the tympanic membrane, the pars flaccida, is slack. This much larger part below, the pars tensa, is tense. The tense part of the tympanic membrane has the shape of a shallow cone. It's drawn inwards by its attachment to the handle of the malleus, which we can just see here. The apex of the cone, where the tip of the malleus is attached, is called the umbo. The tympanic membrane faces downwards and forwards. This is a true lateral view of it. When seen from the side, it's tilted in this plane. When sound waves strike it, the tense part of the tympanic membrane vibrates. Its vibration is transmitted to the malleus. The tympanic membrane is formed of a layer of skin on the outside and a layer of mucous membrane on the inside, lying back to back on a layer of supporting fibers. The support fibers within the tympanic membrane are attached around the circumference, except between these 2 points, to a ring of fiber cartilage, the annulus. The annulus fits into a groove in the bone. To see beyond the tympanic membrane, we'll remove this part of the bone. leaving the annulus intact. This brings us into the lower part of the tympanic cavity, or middle ear. We'll see a little more of it by dividing the tympanic membrane along this line and removing it. Here's the handle, or manubrium, of the malleus attached to the tympanic membrane. Here below it, we can see how thin the membrane is. Now we'll remove the rest of the tympanic membrane. Here, we're looking into the lower part of the tympanic cavity. There's more of it back here and up here, as we'll see. This is the handle of the malleus. This is our first look at the incus and the stapes. We'll get a much better look at them later. Here in front is the opening for the auditory tube, which connects the tympanic cavity with the nasopharynx. We'll look at the auditory tube, then come back to the tympanic cavity. But first, let's look at a dry bone specimen to see where we've been and where we're going next. After taking the mandible out of the picture, we've been looking up at the underside of the petrous temporal bone from below. To see the tympanic membrane, we removed this part of the bone. Here's the bony external meatus. Here's the groove for the annulus. To see into the tympanic cavity,